There's been a big boost for a Bankstown-based charity today. The federal government giving Little Wings some new wings, helping them to give more sick children in regional and remote areas access to specialised medical care. And CEO of Little Wings, Claire Pearson, joins us now. Claire, welcome. Firstly, for those who don't know about Little Wings, tell us what you do.
Thank you, Davina. I appreciate your time. Little Wings is a small charity based at Bankstown, Cessnock and Archerfield airports. And on a daily basis, we fly all around regional and remote New South Wales, picking up seriously ill children and their families and bringing them into major cities to access life-saving medical treatment that simply isn't available in their hometowns.
It is amazing what you do. How will this new plane help?
Towards the end of 2020, we were really reaching capacity. Emissions had increased by over 400% in the last 4 years. And so this little plane will allow us to continue to be able to say yes to families that need us. It'll allow us to support another 800 families annually and make sure that no one goes without just because of their postcode or their circumstance.
You've seen an extraordinary rise in demand. Why do you think that is? And what more do you need to meet this demand?
I think a lot of the demand actually was already there, to be completely honest. It's just that Little Wings has been able to elevate our mission and to reach families when they need us. We've done that by advocating as hard as we can to make sure that when and if a family in the bush needs us, they know to ask for Little Wings and obtain that referral. I think before that, those families were driving, catching buses or potentially even missing appointments for critical situations just because it was just too much pressure. But of course, Little Wings is an organisation that's run by the community for the community, and we have to hustle every day to fuel our planes. So we would love to see people come on board and donate, get involved and volunteer their time, and I suppose just, if nothing else, follow us on socials and champion our cause.
Tell us a little bit about the difference a plane trip that you offer provides to a family with a sick child.
You know, families that are living in regional and remote New South Wales, they have additional barriers that we here in the city don't have. You know, I have a family who's travelling nearly 8 hours to access a hospital. When your child has burns, when your child is on chemotherapy every week, having to drive to and fro every week to make that happen means the rest of your life is on hold. It means your family doesn't have your support. It means your healthy children don't have your time. It means your marriage is under pressure, your finances are under pressure. And particularly women, because it tends to be mothers that are supporting these children, can't work, they can't study, and they don't have access to their support networks. So for Little Wings to be able to pick up these families in the morning, take them to their appointment, and then hopefully fly them home in time for dinner, means that families from the bush can continue to function, to be independent, and hopefully weather this storm that is an incredible challenge and see their child to health and really thriving.
Well, thank you so much for everything you do, and congratulations on the achievement today.
Thank you, Davina.
Let's have a quick check of the weather.